But I want to welcome you and ask you if any of you have studied Japanese style before. 1, 2, 3, 4, 5, 6. Anybody practice this style? Not just study, but practice? 3, 4, 5, 6, 7. That's very good. Study with Stephen Birch? Where did you study? Kiko style is good. Toyohari, anybody? That's very good. And then some new people? Somebody new to Japanese styles? Several, good. Well, I'm going to go to a beginner level, and I think that those of you who are more advanced will be able to pick up some good ideas. As they say in Zen beginner's mind, you learn everything at a different level each time. The Japanese styles is very important to hand technique. I can tell you many things and I will teach you give you some information, but I want you to know that the information in your hand is more important than information in your head. So the first thing I want you to learn is how to use a Japanese needle the Japanese style way, is to use one needle on many points. If you don't insert the needle, then you don't have to throw the needle away. If you insert the needle, then you have to throw the needle away. So this technique, everyone has one needle, no? So you have the needle, and you can practice on yourself while I'm talking. Anybody need a needle? We're good? You can practice while we're doing this too. The first thing we learn in a Japanese school, I attended a Japanese acupuncture school in 1980, a long time ago. And make sure she gets a needle. Oh, sorry. Also, if you don't understand what I say, my English is too fast, just raise your hand. Don't be afraid or ashamed. I appreciate the fact that you speak my language, even though I'm in Germany. So slow me down or ask me again. I'll try to speak slowly and clearly. So this is a needle and a tube, and this is a very common sized needle to use in Japan. But what we do is we reuse a needle. We have to put it back in the tube. There's two ways you can put it back in the tube. One is to two hands, the two-hand technique. And you take the handle, not the needle. If you take the needle, you poke yourself. So you take the handle, you have to close the bottom, and then you drop it. Very easy, right? And then you turn it around, and then you drop it. Or not. I'm not used to this technique, you can tell. But the one-hand technique is supposed to be easier. But in Japan, if you've watched anybody, they take it with one hand, and they reload it like this. It's very fast and easy, but it takes a little practice, and that's what you're going to do. I'll come around and show you, but this is called the one-hand loading technique. Do you use chopsticks? Do you like Japanese food? Then you have easy time, because with chopsticks, you have one here and one here, right? And then two things work together like this way. Can I borrow your pen? I just want to show you. No, this one's good. And I'll borrow this pen, just so you'll see. See, with chopsticks, these two fingers and these two fingers operate independently, as you can see, this way. And I'm going to do a close-up on the camera so that he can get it. Maybe I'll have a background of the paper. So what you're doing with a needle, and let's, can I borrow your hand out here? So we're taking the needle in the two fingers, the thumb and the index finger. Meanwhile, the tube is in the palm of your hand, here. I'll come closer, don't worry. But basically, the three fingers control the tube, and the two fingers control the needle. And you drop the needle in the tube, in your palm. Then the needle is upside down, and you turn it around, and you have a needle. So everybody in Japan who practices acupuncture learns to reload the needle this way. And it's very easy because you can needle one point after another. I'll come around in a minute, just so you can see. So I do this point, tap it in, take it out, this way,